Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is October 9, 2025. This video is on an article titled Sudden Cardiac Death in Newly Diagnosed Non-Ischemic or Ischemic Cardiomyopathy Assessed with a Wearable Cardioverter-Defibrillator, the German nationwide SCD-PROTECT Study, published in the European Heart Journal recently. Sudden cardiac death is a major risk in newly diagnosed non-ischemic cardiomyopathy and myocardial infarction and coronary artery disease, particularly during early guideline-directed medical therapy phase. This was a multi-center observational study in Germany which enrolled 19,598 patients receiving a wearable cardioverter defibrillator between December 2021 and May 2023. Of these, 11,449 had non-ischemic cardiomyopathy and 8,149 had myocardial infarction coronary artery disease. The primary endpoint, incidence of sudden cardiac death due to VT/VFib. Demographics, the mean age non-ischemic cardiomyopathy 58.6 years. MICAD, ischemic cardiomyopathy, was 64.2 years. Age of women was 23.8% with non-ischemic cardiomyopathy and 16.3% with ischemic cardiomyopathy. Mean LVEF was 26.9% in the non-ischemic cardiomyopathy and 28.4% in ischemic cardiomyopathy. Statistics, incidence per 100 patient years, 95% confidence interval. Standardized mean differences were used instead of p-values. What they find? First event incidence 6.10 in non-ischemic cardiomyopathy and 8.64% in ischemic cardiomyopathy per 100 patient years. Total incidence 8.53 with non-ischemic cardiomyopathy versus 14.98 in ischemic cardiomyopathy. LVEF improved to above 35% in 53.5% of the non-ischemics and 51.7% in the ischemics. ICDs were implanted in the 36%. Mortality is 0.8%. Inappropriate shocks 0.5%. What was the limitation of the study? Selection bias limited to VT/VF related sudden cardiac death. No long-term follow-up post wearable cardioverter defibrillator. Key takeaways. Early phase after diagnosis is a high-risk period for sudden cardiac death. Wearable cardiac defibrillators offer vital protection and serve as risk amplifiers. Non-ischemic cardiomyopathy patients face comparable risk to ischemic cardiomyopathy. Challenging prior assumptions. Most events occur within the first 200 days, and it's a critical window for intervention. Twinkle pearls. In newly diagnosed heart failure with HFrEF, the early phase of GDMT is a high-risk window for sudden cardiac arrest. The risk of ventricular tachycardia, ventricular fibrillation, and sudden cardiac death is comparable between non-ischemic and ischemic cardiomyopathy patients. The wearable cardioverter defibrillator or life vest offers a protective bridge during GDMT up titration and doubles as a powerful tool for early risk stratification. Most life-threatening arrhythmias occur within the first 200 days, highlighting the urgency of early monitoring and tailored intervention. Many patients avoid unnecessary implantable ICDs due to recovery of LV function greater than 35% during the use of wearable cardioverter defibrillator use. Hopefully, insurance companies will approve this. Eponyms and historical nuggets. The Danish trial, published in 2016, questioned ICD use in non-ischemic cardiomyopathy, shaped our current guidelines. Scud-Heft, sudden cardiac death in heart failure trial, supported ICD use in LVEF less than 35% with NYHA class 2 to 3. The Varied France study, wearable cardiac defibrillator utility in transient risk patients. The real-world data echoing SCD-PROTECT findings. Wobning Registry 2016, German cohort demonstrating wearable cardiodefibrillators' efficacy, particularly in non-ischemic cardiomyopathy. Prolonged study, delayed ICD decisions after wearable cardiodefibrillator monitoring, reduce unnecessary ICD implantations. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.